Hi guys, this video will be about disorders of esophagus and we will study three main disorders that are the strictures of esophagus, Plummer Vinson syndrome and Globus Hystericus. So coming to the benign strictures of esophagus, what are these strictures means? They are actually muscle cord of esophagus getting damaged. So when we know that the esophagus has mucosa, submucosa and muscularis, there is inner circular and outer longitudinal muscle. So when this muscle cord of the esophagus is damaged, that will lead to strictures. Coming to the etiology of strictures, it can be due to burns by corrosives like acid or alkali or dermal burns. It can be due to trauma by the foreign body, by the instrumentation or due to the external injury. It can be due to reflex gastroesophagitis, that is there will be development of ulcers. The ulcers can also due to infections like diphtheria and typhoid. There can be due to anastomosis, surgical anastomosis, or there can be congenital strictures, that is the most commonly in the lower third of esophagus. So what are the etiology? Can be due to corrosive burns, trauma by foreign body, external injury or instrumentation, reflex esophagitis, there will be word ulcers. Ulcers can also be due to diphtheria and typhoid. There can be surgical anastomosis and also congenital strictures. Now coming to the clinical features. So there will be a progressive dysphagia. First the dysphagia will be towards the solid, then the dysphagia will be towards the liquid. And when there is complete obstruction, there will be regurgitation, cough and malnourished individual. So progressive dysphagia, first to solid and to liquid, and when there is complete obstruction there will be regurgitation, cough and the individual will be malnourished. The diagnosis is by barium swallow or esophagoscopy to exclude the malignancy. In barium swallow what we can see? We can see the esophageal stricture, and in esophagoscopy we should do to exclude the malignancy. Now coming to the treatment. The main treatment is prograde dilation with Baughis. So we will pass a esophagoscope to visualize the structure. Then we will insert a Baughis. This will require frequent dilation also. So with an esophagoscope we will insert a Baughis with frequent dilation done. So that is prograde dilation with Baughis. And then we can do gastrostomy. It is mainly for feeding during the inflammatory stages. So for the inflammation to subside, for giving rest to that inflammation, we will do feeding with the gastrostomy. And once the inflammation subside, again we will do Baughis. And this Baughis can be prograde or retrograde. We can also give a thread for swallowing also. So that is gastrostomy, and then we will do prograde or retrograde Baughis. Next, the surgery. Here what we are doing is we will cut the stricture part of the esophagus and reconstruct it by stomach, colon or jejunum. So we will cut the stricture, reconstruct by stomach, colon or jejunum. So this was all about the strictures, etiology, clinical feature, diagnosis by barium swallow or esophagoscopy, treatment by prograde dilation with Baughis, gastrostomy and surgery where the strictures are cut and replaced by stomach, colon and jejunum. Okay, now coming to Plummer Vinson syndrome, or it is also known as Patterson-Brown-Kelly syndrome. So, the classical features of Plummer Vinson syndrome are: first one is dysphagia, iron deficiency anemia, glossitis, ankylosing stomatitis, koilonychia and achlorrhea. Okay, dysphagia, iron deficiency anemia, ankyloglossia. A is ankylosing stomatitis, then koilonychia and achlorrhea. And here we can see mucous membrane atrophy. Okay, so mucous membrane atrophy can be seen. Now, it is more commonly affecting the female more than 40 years. Then the diagnosis can be by barium swallow and esophagoscopy where we can see a post-cricoid web. So we will see a post-cricoid web, okay, by barium swallow or esophagoscopy, and this post-cricoid web is actually due to subepithelial fibrosis. So subepithelial fibrosis will give rise to post-cricoid web, and then 10% of this Plummer Vinson syndrome can become post-cricoid carcinoma. Not only post-cricoid carcinoma, it can also become tongue cancer, buccal mucosa cancer or carcinoma of pharynx, esophagus and stomach. Treatment is correcting the anemia. We have to give oral or parenteral iron. Serum iron levels are more important than hemoglobin. So we have to correct the iron deficiency anemia first. Then if there is B12 or B6 deficiency, we have to supplement that also. Then if there are dilation of the web, if there are webs, that is post-cricoid web that we see in barium swallow. So this web has to be dilated by esophageal Baughis, similar to what we done in strictures. Now coming to Globus Hystericus. Globus Hystericus is also known as Globus Pharyngeus. Actually, this is a functional disorder. There is no structural problem. So the patient will complain of the lump in the throat. So patient will come and say that he has a lump in the throat. But when we look or do the clinical examination, there will be no lump. The clinical examination will be normal. There will be normal pharynx, larynx and base of the tongue. So here there is actually no true dysphagia. The feeling is there. And this feeling of lump in the throat is more marked between the meals, and that is not there during the meal. So during the meal, the person will not have a problem. But between the meals, after the meal and all, the patient start feeling that he has a lump in the stomach, and then he also will have fear of cancer in the throat, but the clinical examination is normal. So what we have to do is we have to reassure the patient if no cause is found. So this was all about the disorders of esophagus. We discussed about strictures of esophagus, Plummer Vinson syndrome and Globus Hystericus. So hope this was useful. Thank you.